Hello and welcome to Network Insights from Move Consulting. My name is Craig, I'm one of the directors here at Move, and if you're new to the series, Network Insights itself is your opportunity to listen into our conversations with some of the world's leading physical activity, health and wellbeing experts from across the sector. Today's conversation is going to focus in on supporting women to be more physically active. So, without further ado, I'll hand over to Elaine to get us started.
Hello everyone, thank you for joining us. It is a real pleasure to have Vicki Bateman with us, who is a physiotherapist, I can't say that, physiotherapist based, specialising in MSK and women. And this is the first time we've met. I know you've known Craig for quite a long time, so I am fascinated to find out a little bit more about your background and your passions and interests. So I'll hand over to you to kick off.
I've worked as a physio now since 2012, so last 10 years. Started off in MSK in private practice, and then I ventured down the women's health route as well, more so after both of my children. And then kind of the area I'm most interested in now is pre and postnatal exercise, postpartum rehab. Really, when I had my first child, there wasn't much out there in terms of resources, didn't have a clue where to start with my kind of postnatal rehab and getting back into exercise. Did it all the wrong way, learnt many lessons. I do have a real keen interest now in helping women get back to doing the things they love, really, after pregnancy.
So part of that journey, what sort of things have you been involved with in terms of programs, advice development and developing your own practice, I suppose, from those early stages?
Yeah, so I work quite closely with a couple of people in the area in Cheshire who are fitness professionals. So anyone I see in clinic, for example, who has any issues with their recovery, we kind of team up and I guess form a bit more of an MDT in terms of their recovery, because we find that works much better than obviously doing it solo. So we, the fitness professionals I work with have progressive levels of rehab postpartum and also through pregnancy, where I can just send my patients to, for example. Currently putting together some interesting stuff at the moment with another fitness professional in terms of getting ladies back into exercise progressively, and also a lot around education. So deliver workshops locally as well when ladies are pregnant and after they've given birth, to just give them a bit of confidence in terms of getting back into exercise, knowing where to start, knowing what to look out for as well, and when to seek any kind of further medical advice as well. So yeah.
So
Vic, sorry. Go.
In relation to the work that you have been doing, and you've mentioned working with some fitness professionals to bring information together, are there any kind of key sources of information that you are bringing things from, or is it your own knowledge as a specialist physiotherapist? What are some of those kind of big areas that you're looking at?
I think we do take, I guess some of it's our knowledge, in terms of MSK and how ladies recover and stuff. And some of it is taken from resources like there's some new guidelines out there, or more recent guidelines in terms of returning to running postnatally. So where you'd start, how you'd start, and how you'd progress. So kind of that's more what we'd consider end stage rehab, to getting back to higher impact activity. So the return to running guidelines have been created. They're evidence-based and they've been created by MSK and women's health physios. So they're quite new, but they're really good for not only you know, your average Joe has just had a baby, but also for medical professionals and fitness professionals who are coaching and rehabbing these ladies. So that's a big resource in terms of the higher impact side of things. And then there's quite a few programs emerging at the moment. Have you heard of Carry Fit?
Tell us more about that.
There's Mummy Fit and there's Carry Fit, which are two big programs that are well known over the UK. Carry Fit is like a baby wearing workout program that was developed for women postnatally to get back into exercise. So I guess it considers one of the main barriers with regards to returning to activity being, obviously, you've got a small child and, you know, half the time they want to be attached to you. So I think that's quite a popular one for ladies, and I think it's subscription based as well. So instead of having to, you know, get out the house with a newborn and stuff, you can do it from home. So that's one of them. That's been produced by physios and other professionals as well. So I guess it gives ladies a bit more confidence when it is backed by, you know, medical and fitness professionals that specialise in that area. The other one is Mummy Fit. So PTs or personal trainers are trained to deliver pre and postnatal workouts. And that again is kind of standardised, so you know that people specialise in pre and postnatal, and that's delivered all over the country, so that's quite accessible to women as well. So there are two kind of big programmes out there. So I'm trying to think what else. There's also Holistic Core Restore. I don't know if you've heard of that before. So basically that's prenatal, postnatal, so when you've had children, and also menopause as well. So when we get a little bit further along in our journey, so that's a big one in terms of getting ladies back into exercise, really. So I'd say they're the biggest ones out there at the moment.
Okay. And when you mentioned one of the challenges for mums. We're also hearing quite a lot about the menopause, which is obviously closer to my heart at the moment, I suspect. But what are some of the challenges that women have when trying to be physically active, that they're seeking help for, and they need that support from you for?
Yeah, so as in, I guess as in program design, or as in if they were to come and see me in clinic?
Well, a bit of both, probably, really. So it's just understanding, because a lot of the people that watch this are trainers themselves, and it's just being aware of what some of the challenges might be that women are coming to them with.
Yeah. So first of all, it's simply they have no idea where to start, so they don't know where they're at. You know, if it's postpartum, they don't know where they're at in the recovery. They don't know when they're able to start and what they're able to do. Some ladies might come and see me because they're having issues in their recovery, like pelvic floor dysfunction, like leaking when they're exercising. Things just don't feel right. So there's lots of reasons why they would I guess there would be a barrier for returning to exercise. And obviously some ladies might need a bit more input in terms of their rehab and just a little bit more guidance along the way to progress slowly. So I guess that's one of the biggest barriers, is the confidence of knowing where to start and possibly having some issues in their recovery.
In terms of the evidence, if we call it, the guidelines that exist for being physically active, and if we focus in on adult life and into pregnancy and beyond as well, there are three main kind of guidelines that stand out, and the core message across all of them is pretty consistent, i.e. as an adult, 150 minutes of moderate activity in a week to try and build that into your activity levels. And as you either become or after pregnancy, to maintain the levels of activity that you had pre-pregnancy, if that's the right way to say it. And it's always that case of whenever starting something new, don't dive into, if you're inactive, trying to run a marathon straight away. Is that the same kind of principle carried through into all stages of pregnancy and beyond? And even, you mentioned menopause before, is there any nuance to guidance around being physically active throughout those stages of life?
I'd say that's pretty much it. It is quite generic. It is quite, I guess, starting exercise or getting back into exercise is quite individualized as well. So that's where it can be quite tricky. And that's where there's so many other factors that you have to consider when designing programs for women as well. From, like you said, the menopause, what stage of life they're at, and also I guess the benefits they're going to get from the exercise and the activity as well. And I think one of the hardest things is probably getting ladies to understand the importance of exercise throughout pregnancy, especially when they've never done it. A lot of ladies think, well, I've never done exercise. Now I'm pregnant. Am I okay to do exercise? So I think having that generic guidance is, I guess, is easier for ladies to understand. And it's a good starting point. So,
what are some of those benefits to being active during pregnancy? What sort of things do you say to people who are thinking of starting?
So not only do we know it's massive for kind of mental health side of things, controlling weight gain in pregnancy as well, just helping to kind of maintain strength throughout pregnancy, leading up into labour, because we know that labour is kind of like running a marathon. It's a big event, and in terms of kind of the medical side of things, reducing the risk of diabetes in pregnancy as well, reducing the risks of complications throughout labour, throughout their delivery as well. There's loads of kind of benefits there. I think also in terms of considerations, there's a lot of ladies who are, we talked about how they're unsure about how to get back into exercise postnatally, in terms of if they're breastfeeding, for example, and they're worried about it affecting their milk supply and things like that, whereas we know now the evidence shows that it doesn't. There's no real effect on milk supply, so that's more reassuring. So I guess it's educating ladies that it is safe to return to exercise, and the benefits are massive.
Yeah. From a program design perspective, we skirted along it and then kind of focused in on the individual benefits and considerations for the women in kind of focus, I guess. But from a program design perspective, are there any general ideas? I know from a generic perspective, one thing that might seem obvious from what you've shared already, Vicki, is, and to emphasize its importance, even though it might be obvious, is to create and save that space within the design of a program. So, for example, a common, let's say, error we see in program design is kind of a rush to get through week 1, 2, 3, 4, or whatever it could be. Whereas that pace, we've spoken about this in previous episodes of Network Insights, that pace, it's a little bit like a treatment plan. It's take a dose of activity, and that will help you support your well-being or support your general physical health as well. So are there any other general considerations if, I don't know, I'm working in an active partnership and thinking of commissioning a program connected to This Girl Can or This Mum Moves, for example? What are those big fundamental considerations I need to be thinking about from your perspective?
I'd say in terms of like program design and getting people back into exercise, there's so many factors, I guess, that need to be considered. So, for example, have they done exercise before? If they haven't, then they have to start slow. They have to start progressive and work towards a goal, like you said, with a treatment plan. So a lot of the time, in terms of, for example, like returning to running, you would not just go and run your 5k that you used to run before pregnancy. You would consider starting with like the couch to 5k, which is like a progressive incremental loading, I guess, to return back to your running. So I guess it's considerations would be that progressive loading, I guess. Also where they're at in their recovery. So, if they're having any signs and symptoms of any pelvic floor dysfunction, for example, postnatally, do they need to seek some more medical advice before they return? Do they need to regress things a little bit? So I guess having that support and knowing where to be signposted to is another big factor. Trying to think what else. Also, there's a lot around like cycle mapping at the moment. Have you heard of anything to do with kind of menstrual cycles and things like that? So there's loads of research at the moment on menstrual cycles and where people can change and adapt their workouts as well to kind of maximize them. So yeah, there's a lot of that going on at the moment. Trying to think anything else.
What about older women? I'm determined to find out about menopause here, aren't I? Been through, yeah, I got the t-shirt anyway. But yeah, what about some of the for older women? What sort of issues are cropping up when you for that group of people?
Yeah, so there's obviously, as we get older and our hormones change and everything, there's an increase of a lot of things in menopause. There's a lot of around kind of stress and anxiety and depression related to hormonal changes, and obviously we know physical activity can massively help with mental health symptoms. There's muscle mass loss, high risk of osteoporosis, so encouraging women to do more resistance-based exercise as well as their cardio side of things. So that's kind of the main considerations for exercise planning and programming in women of peri and post-menopause, as well as educating them on the effects of exercise for the mental health and for their physical health as well. So there's lots of benefits, but yeah, generally I massively encourage ladies to start exercising who come and see me and they just never really have. And there's also the whole kind of mental health side of things, and stress levels in menopause. Cortisol levels massively increase as well, so and we know that plays a big role in weight gain and stuff in menopause as well. So that's where the resistance training comes in, but also the supportive factors to allowing women to sustain exercise programs. So nutrition side of things is a big one as well, especially when ladies want to control their weight in menopause. So I could probably open a can of worms there.
That's the key part to one of my questions. In terms of all of these things to consider, it can seem like almost the impossible task to tick all of these boxes if that's the right way to approach it, which I know it's not. So one key factor is to understand the individuals that you're supporting, or to understand the audience that you're aiming for the design of an intervention or a program to cater for. So there's a couple of brilliant examples. This girl can from Sport England in relation to engaging particularly younger women into activity is a key part. We have things like Couch to Fitness. They've recently released their pre and post natal program, exercise program, so pre-designed video exercise programs. And you've mentioned a good few yourself in terms of some of the things that are on offer there. So in terms of understanding the needs of Are there any golden nuggets that you would share, or just reinforcement of simple principles? All of these considerations that you've spoken about, how do we make it a little bit more assured that we're going to get it right for those women, so their first steps are positive ones?
Yeah, it's so tricky. I guess it's I think it's the gradual progression of exercise, so where to start and kind of how to progress. It's knowing when to, like I said before, knowing when to signpost people, what kind of things to look out for if they're having any issues with exercise and they may need to adapt it. Obviously, the education is a massive side of things as well. I guess I struggle to find any real golden nuggets. It's just I think the most important thing is just confidence and reassurance of the benefits of exercise to all women, physically and massively mentally as well, given obviously recent times. I go on, sorry.
Yeah, no, I was just wondering, that education piece, how well do you, from what you've described, I'm hearing that it's not well known, the benefits of activity during pregnancy. So, and there is a massive education piece to be done. So who do we need to upskill? Who do we need to be able to be giving those messages out to women? And timing of that is obviously quite crucial. Have you any thoughts around that area?
Yeah, so I think targeting wise, it would be more kind of the NCT groups and the groups that women would attend throughout their pregnancy. It's all well and good educating women postnatally, which I do, but if they can be really prepared, when they're pregnant or before giving birth, then that's probably the biggest thing. So kind of through NHS, through NCT programs, and where they deliver face-to-face education workshops and things. A lot of the time, I'm trying to think if it was ever mentioned to me in terms of the importance of exercise. I don't think it was when I attended, groups during pregnancy. And I think it's also important. There's a lot of women throughout pregnancy who suffer with certain medical conditions, certain aches and pains, pelvic girdle pain being one of them. And I guess it's knowing that it's still safe to exercise. It is still safe to exercise. Things just may need adapting. But the more consistent you can be throughout pregnancy, the easier it's going to be postnatally as well, getting back into exercise.
You've hit on there the second part of what I've been hearing from what you're saying, which is you mentioned at the very beginning you have a good relationship with trainers in your area, and they obviously are skilled in this area. So how did you make that link? How did that work? And if there are trainers out there who want to make links with people like yourself, what advice can you give them for doing that?
To be honest, a lot of it's through word of mouth, through kind of reputation, social media as well. Having a look at what's out there in the area, meeting up with people, just kind of gaining a bit of a network locally. But also, you also want to know that they'd be the right people to refer to, to kind of take over the rehab side of things and stuff. So, the route I took was just engaging with people who are local in the area and getting a bit of an idea of their qualifications, what type of people they work with, and things, and the type of work they do, to gain that kind of that trust with them as well. And just being on the same page with regards to, okay, I've done what I need to do now. I'm quite confident that you can take over the rest of their kind of exercise program and rehab.
Yeah, you mentioned earlier on about working as an MDT, a multidisciplinary team as well, and that concept applies in outside of a kind of a medical setting as well, doesn't it? It's that idea of where do you add value for this individual who you're wanting to support to be active, and where you can't add value or you don't know, bring another person in to support and do that. And as much as bring people around you to support, there's that education piece which you've mentioned a good couple of times of how can you empower that individual to educate themselves or become more aware and informed. And I think we've heard this so many times when we've spoken about physical activity and guidelines for any demographic or group, where it does boil down to the consistent, simplistic messaging is really, really key, because particularly for long-term health conditions, which we know at the moment, we've spoken about a good few times before as well on Insights. We've had the consensus statements on risk for those living with a long-term health condition. And that's a targeted group whereby the nervousness around the risk, even though the evidence tells us clearly, it's still there, even though all the evidence is pointing to the benefits massively outweigh the risks. So, and I don't know, what are your thoughts? One reason why that kind of message might keep just going around and around is due to elements of inconsistency or ambiguity within what's being shared. Are there any common misconceptions that you're hearing from the ladies that you work with or have supported around the risks around being physically active at whatever stage, or is it not necessarily as clear and consistent?
I think it's more clear than it was nowadays. I think especially kind of in pregnancy, if there's any ladies who have any medical conditions or may have had previous miscarriages, for example, they're very reluctant to even start upping the intensity of their exercise or knowing what to do to remain active. So there is still there's a lot of myths out there that just need busting, really. And maybe it is just a repetition of that, getting that message out there. And I say it again, the education, like you said, empowering people to manage and have the confidence in, of their own, taking care of their own physical health and mental health. So yeah, there are some barriers, but we just need to keep reassuring, keep building confidence, and keep referring to the evidence and the guidelines that are kind of building more and more now. I'm not too sure what else we can do, but like you said, the evidence is out there of the benefits of physical activity from kids through all stages of life, women and men. So yeah, I think the biggest factor is that knowledge and that of the benefits, where to start, how to start, when to start, Yeah.
Are there any bits of advice or signposting that you'd suggest if I am, for example, a fitness professional and thinking I'd like to follow a similar path to Vicki and start to specialise in supporting more women to be physically active, whether pre or postnatally or otherwise? Where might that education come from? Is there a qualification I can sit or a resource I can take a look at? Is there anything that comes to mind? Because we could pop links or anything around there into the post below this video to maybe help. We've mentioned physical activity guidelines. They're certainly a useful resource to have a look at. But is there anything more that you'd suggest, Vicki?
Yeah, so I think there's so many courses out there, from a one-day online course which kind of certifies you as a specialist in pre and postnatal exercise to maybe going down the uni course. So there's a massive scope there. I always find that the best kind of qualifications are I don't know if you've heard of Borough Education. So they're real high quality courses in pre and postnatal rehab. You learn a lot about the kind of physiology side of things as well, and that takes you through postnatal and all the way up to menopause, and then that's where the holistic core restore side of things fit in. So I think that focuses a lot on education and also program building. So I always kind of when I know PTs, for example, have been through those courses, I'm like, okay, they've got a decent level of knowledge there, so they're pretty good. I guess in terms of when to refer on and when to seek help if anyone's having issues with their recovery, whether that's through pregnancy as well. There's a lot of women's health practitioners, or there's more now over the country, so you can access them via the Mummy MOT website. So there's a directory of specialists in that area, so a lot of ladies will will be able to search for a physio in that area throughout the UK. I'm trying to think anything else. Yeah, they're probably the kind of the biggest ones, I think. Obviously, there's the UK coaching stuff that was developed as well, in the past, with regards to helping coaches who coach women return back to exercise and stuff as well. So there are lots of kind of resources out there. There's one by, is it British Association of Sports and Exercise Medicine, in exercise and pregnancy for kind of recreational athletes and elite athletes as well. So that's quite a good resource. And then the EIS as well, they've developed some good stuff around exercise through the menstrual cycle and stuff as well, and programming that way. So there is more and more. It's just dotted all over, really. There's nothing all together.
There are some key organisations that are particularly, I know, Elaine, you've mentioned menopause a couple of times, and I keep leaning back into pregnancy, not meaning to, but obviously I can't necessarily speak for the menopause myself. That said,
for pregnancy.
Well, yeah, at least as a father I can.
Yeah, okay.
But the Active Pregnancy Foundation, they aspire to do a little bit of that coordination work, if you will, of bringing information together. And there's some good information on their website around guidance for professionals, signposting to a good number of the things that we've spoken about today already. And it does come down to, as a charity, taking that approach to convey consistent messaging around being physically active throughout. And it is one of those things where it is safe to do, but not necessarily perceived so, because change is at the heart of this. And from a physical activity perspective at Move, what we focus on is behaviour change, and at whatever stage throughout life, it's a constant thing that's happening, but there are these big stages of change that we potentially will experience. So that support, as well as mental health and physical health, you've also got supporting just general well-being and potentially elements of anxiety that are connected to just experiencing change as a broad as well. Yeah. So it's certainly an area that's really, really difficult and challenging to get your head around. But from what I've understood so far, understand the individual and what their needs are and support them as best as possible. So Elaine, I'm not sure whether I spoke over you or not, but was there anything that you wanted to add there?
No, I think that there's some really useful signposting to different resources there, and some really useful insights that I think people will be able to use in their own work. So thank you very much.
Yeah, thanks so much, Vicki. I guess closing notes in general, if we are to consider and think about supporting more women to be more physically active, what would your one thing that we need to go away and think about be?
And to be physically active, I think it's keep it simple, make it kind of, I guess, program design wise, easy to access, easy to follow, and inclusive in terms of considering all the external factors that affect motivation and, I guess, consistency with exercise. If that makes sense.
That does make sense. Thank you so much. So thank you everyone for listening into this conversation of the Network Insights series. We hope you have found it insightful. As mentioned, there's lots and lots of different things that we have discussed and considerations to make, of which links to key resources and websites we'll make sure are posted below this video. But for now, that's it. So we will see you again next month. Thanks again, Vicki, for taking the time to speak to us. And
thank you.
keep well, everyone. Bye now.